Okay. And so just to very quickly, we are recording this session. So it will live in perpetuity, and we'll put it on our website. We have many more people registered than are here. I know that, but I know that they're interested in seeing a recording of this. So welcome to this event. This is being co-hosted by the Faculty of Social Science and Humanities and the Faculty of Health Sciences at Ontario Tech University. My name is Peter Stoett. I'm the Dean of the Social Science faculty. I've worked on climate change, governance, and justice issues for as long as I can remember. And I'm currently co-chairing an assessment for the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services, which involves climate change in a big way. Public health is deeply impacted by climate change, and this needs to be part of the framing, I think, of the climate change discussion. As usual, those who contributed the least to the problem are suffering the worst impacts. And this is made clear, I think, in an important publication, which is the latest report of the Lancet Countdown on Health and Climate Change. Makes this quite apparent, and I'm glad to provide that resource. But needless to say, we're seeing on a global level the impact of climate change now. It's not in the future, it's happening. And it's having, as I mentioned, a deleterious impact, especially on those that have the least resources to cope with it. So I do suggest the Lancet Countdown as a source of fantastic material and statistics that have been accumulated. I'm very pleased that today we have four well-known experts in this field to help us understand the links between public health and climate change. They all come from very different perspectives, and that's what we tried to do with this panel, was generate some diversity. I'll introduce them briefly, and then I'd like to allow each of them roughly 5 minutes to introduce themselves and tell us a bit about their own work and what they think the priorities are moving forward. And then we have a set of questions which I will pose to the panel. Our first speaker will be Shilpa Dogra. She is an associate professor in kinesiology in the Faculty of Health Sciences at Ontario Tech University, where she runs the Health and Human Performance Laboratory. Her research expertise are in the areas of active aging, active transportation, built environment, and human physiology. The overarching goal of her recent work is to facilitate the uptake of active transportation to influence the health of people on the planet. The next speaker is Keith Martin. Keith Martin is the founding executive director of the Consortium of Universities for Global Health in Washington, D.C. And many Canadians here will know that between 1993 and 2011, he served as a member of Parliament in Canada's House of Commons, holding portfolios in foreign affairs, international development, defense, and health. And he's also a member of the Queen's Privy Council. Next, we have Cristina Romanelli. She is a program officer working on biodiversity, climate change, and health at the World Health Organization in Geneva. She also previously managed the Convention on Biological Diversity's joint work program on biodiversity and health. And she led the development of a comprehensive state of knowledge review on biodiversity and health, and of a biodiversity inclusive One Health guidance adopted by the CBD Conference of the Parties. And I'm very pleased that Patrick Kinney has joined us as well. Patrick is the Beverly Brown Professor of Urban Health at Boston University. He created and directed the first climate change and health program in the United States at Columbia University. And he's also a member of the Lancet Countdown, or one of the authors of the Lancet Countdown report I just referred to. So we face I won't mince words, we face a grave future. Climate change is advancing, and it's having an impact, as I said, on the health of those in various parts of the world, ultimately all of us. So I'm very pleased we've got this panel to discuss this important topic today. So Shilpa, can we begin with you, please?
Absolutely. Thank you so much for having me here. I'm really excited about this joint effort between our faculties, because I think an interdisciplinary approach is so needed to so many of the issues that our society is facing right now. So I think this is a great topic, and certainly one that's pressing, to say the least. So as Peter mentioned in the introduction, my training is in exercise science, so you might be wondering what I'm doing here, but you know, I've worked with various populations, including older adults, people with chronic diseases. A lot of my early work focused on asthma and exercise. And so there are some sort of natural intersections with climate change and the changing environment that we live in. You know, on the one hand, from a chronic disease prevention and management perspective, climate change is having a huge impact. We're seeing an increase in respiratory diseases, cardiovascular disease, the impact on our local environment and how that's impacting our day-to-day mobility and activity is also changing the risk of these diseases. And of course, from an infectious disease perspective, you know, this melting of the permafrost is only going to bring us new and more exciting viruses than the one that we're currently seeing. So I think there's some significant intersections there with chronic disease prevention and management, and certainly my perspective on respiratory health and asthma. You know, there's a huge intersection. We saw in Ontario when we got rid of coal. Not only did the number of smog days go down, but the incidence of asthma in children went down as well. So there's a real direct link here between climate change and health. So that's one angle. I also see, as an exercise scientist, a solution, and that is active transportation. We know, at least in Canada, that per capita, one of the biggest reasons that we have a high carbon footprint is because of transportation. So transportation is one of the biggest greenhouse gas emission sources at this point in time. And per capita, so per Canadian, transportation is a huge contributor to that. So to me, it seems we have a bit of a solution here if we can create a bit of a modal shift and think about using bikes and walking instead of personal vehicles, then there's an opportunity to really shift or to address some of these issues. So along with sort of active transportation in whole and its impact on climate change, it also directly targets a lot of other initiatives. So I've worked with our community around age-friendly environments. And certainly if you can improve active transportation, you have a more age-friendly community. A lot of communities want to be barrier-free for inclusion of people with disabilities, for example. Again, if you create more opportunities for barrier-free active transportation, you have more mobility and access. We also are really pushing for healthy cities, sustainable cities. And so all of these things, active transportation is a solution that intersects across multiple priorities. Some of my recent work has focused on active transportation in older adults specifically. And what we've talked about with this community is how can we reduce or remove some of the constraints that they're experiencing? And it's really interesting because this population has a totally different experience of active transportation. We just got 55 centimeters of snow, so there's very limited active transportation today. But on the other 362 days of the year or so, there are unique constraints that older adults experience. So, for example, most of us would never think that the lack of public phones is a barrier to going for a walk or cycling. But for older adults who don't have their own cell phone, this is one of the big reasons they don't go out. If they fall, they have no way of contacting anyone to come help them. So there's these little things that we have created in our environment that are creating constraints to people walking and moving. Some of our recent work is focused on e-bikes, so pedal assist e-bikes, where the user is actually putting some effort in. And there's huge potential here for a modal shift as well. You'll see in many countries across the world, there's a huge surge in e-micromobility use. And so whether we like it or not, these changes are coming. And so we need to start thinking about how we can support this shift and create the infrastructure to support it. I'll wrap up, Peter. Sorry, I don't know. I didn't really time myself there, but I guess I'll wrap up by saying, to me, this intersection of climate change and health is absolutely critical. I'm a scientist. I love being in the lab, looking at physiological responses to exercise, but there's going to be no planet left to do that work on if we don't shift our focus to climate change. And so to me, it's absolutely critical that we all do what we can. We are global citizens first and scientists second. So hopefully we can all come together to work on some solutions. I'll leave it there.
Thank you, Shilpa. Keith?
There you go. Hopefully I'm unmuted right now. Thank you so much, Peter. It's really wonderful to be with you and to be with some old friends and new friends here. As Peter mentioned, I'm Keith Martin. I'm here about a kilometer north of the White House here in Washington, D.C. So the organization that I'm the executive director of is the Consortium of Universities for Global Health. We have 182 academic institutions around the world and a network of 33,000, mostly scientists, but also others that are devoted to our mission, which is to improve the health of people and the planet. Now, why that other part of the planet, which was just added to our mission recently, really reflected our ongoing and long-term commitment to address what the essence of this discussion is that Peter's leading, which is how we can deal with the existential threat of climate change and how that's going to affect health. So what do we do at CUGH? Well, as I mentioned, we work across research, education, service, and advocacy to achieve our mission. We have various products and things we do. One is our upcoming conference, which is taking place at the end of March. You're all invited to come, and please register now. We have our lowest rates now until the end of the month, and you can learn more about it at cugh2022.org. And in fact, a number of you, particularly Christina, has actually participated in our conferences, as has Peter, over the years on some really important opportunities, which we'll discuss in a minute. We also run various sessions specific to the issue of climate change and how are we going to mobilize this massive asset we have on one side, academia, and how can we take the incredible products, people, and assets that they have, and how can we deploy that to be able to move the ball forward, which is what Shilpa mentioned, is how do we move forward quickly to address this challenge. We ran a pre-COP26 session on October the 15th. You can go to our website at cugh.org and take a look at the solutions that we offered at that time. And we're going to also be doing that in advance of the COP27 in Egypt. So where do we sit right now? Well, the fact is, coming out of the COP26, and COPs are really good for countries to get together and others to discuss the issues. But if you're looking for action, that's not the place where it's going to be. So where we sit right now is it's too low, too slow, and as Peter mentioned, we're running off the edge of a cliff. What do I mean by that? Well, right now, our goal is 50% reduction in carbon dioxide emissions by 2030. And right now, we're at 25% of commitments. So we have commitments on paper, but the action does not align with the urgency that is before us right now. But the problem, actually, I would say to you, is actually narrower than we think. You don't need all 193 institutions that were at the COP to actually do something. The interesting thing about it is that 80% of carbon dioxide equivalent emissions are actually made by 20 countries. And within that, there are only 4 sectors responsible for that. And those are energy, industry, agriculture, and transportation. So think of it this way, our bandwidth to actually impact the challenge before us is actually much smaller than what we think it is. And that is an opportunity. So where do we go from here? Well, we have to understand that action on climate change is not an international effort. These are actually political choices. And as a former politician, as Peter mentioned, and as a physician, I've seen this play out. So we were listening to this call today. We need to actually get politically active. The good thing is that we actually know what to do to address the problem at hand. And let me just provide some opportunities. One is we need to put a price on carbon. 2, we need to end oil subsidies quickly within the next 3 to 4 years. 3, we need to change building codes. 4, we can change and incentivize the way utility companies work. There's a huge opportunity to change the way those utility companies get their energy. Governments, healthcare sectors, and others need to be able to focus on buying clean. And another part I want to emphasize, and Christina and Peter have been leaders in this field, is that the opportunity for nature-based solutions. So we not only need to actually stop throwing carbon dioxide into the atmosphere and ramp up the levels at which we do this. So we meet the intermediate target of a 50% reduction by 2030. But we also have to do something else. You have to pull carbon dioxide out of the atmosphere. The great thing about it is that we have the solutions right in front of us. And that is we can focus on protecting the critical ecosystems identified by the IUCN. The IUCN has actually identified a series of critical ecosystems around the world. These are not only important to deal with climate change, but they're also really important to deal with the other existential threat, which is the catastrophic loss of biodiversity that we're faced with now. Now, the really cool thing about it is that the drivers of climate change and the drivers of biodiversity are intimately entwined with each other. They're inseparable. So we can hit them both at the same time, but it's going to require solutions, and we can talk more about those solutions in a bit, but I know Christina and Peter will fill you in because they're the experts in the space. But I've been working in this for 30 years, trying to drive solutions that will improve not only health, but the social determinants of health. But the impacts of climate change, and I'll close here, Peter, is that the impacts of climate change are beyond what Shilpa mentioned. They include exactly what she said, but they include issues of poverty, issues of migration, issues of conflict, issues of water security, food security. There's a long list, and all of those are actually will address all of the sustainable development goals in a negative way. And you can pick any one of them, and you can see how the climate change biodiversity crisis is going to smash all of them down into the ground. So we can talk more about that in a bit, but thanks for the opportunity, Peter, and we'll delve into this more, I know, in a bit.
Okay, thank you, Keith. Christina.
Terrific so far. Thank you so much for the opportunity to introduce some of our work within the WHO Department of Environment, Climate Change and Health, where my own work focuses on the nexus between biodiversity, climate change, One Health, and nature-based solutions. So thank you so much for introducing that, Keith. I want to begin by saying that I think today's dialogue is exceptionally timely because our success as a global community in tackling the urgent climate crisis, which incidentally is also a health crisis, and coincides, as Keith just mentioned, with an ongoing biodiversity crisis. So our success in tackling these intertwined crises absolutely hinges on establishing the strategic and interdisciplinary and cross-sectoral partnerships that Shilpa and Keith have just mentioned at local, national, regional, and global levels, including with the academic community, to design, finance, and implement policies, plans, and programs that are coordinated, coherent, and well-aligned. I think I really want to begin by emphasizing the very real sense of urgency in moving towards this direction as an essential precondition for achieving some of the various the aims that have been set out in the conventions and agreements, the Paris Agreement, the forthcoming post-2020 Global Biodiversity Framework, and the the Sustainable Development Goals moving forward. Let's focus on the post-Glasgow period alone. While in Glasgow, countries certainly haven't treated the climate crisis with the urgency it deserves, as Keith just mentioned, there still has been, and I think it really is worth noting, an unprecedented amount of mobilization of the health community around climate and health, and with very good reason, as together these together with the biodiversity crisis, need to be tackled jointly rather than through the respective silos that we've worked so hard to create across the sectors. So while there's no question that governments at COP26 continue to lack the ambition to treat the climate crisis with the urgency it deserves, even in the midst of a global pandemic, many in the health sector have stepped up to the plate more than in any previous climate COPs to raise the voice of health practitioners for climate change. And I'll mention a few ways in which we've been working at WHO to support these efforts. A couple of the entry points that I want to focus on today can be summarized in two key WHO documents. Maybe we can share some of the links with viewers. So one being a WHO Manifesto for a Healthy, Green, and Just Recovery, which contains 6 essential prescriptions and over 80 actionable entry points. And another is a new special report that WHO had launched on the health argument for climate action. Also happy to share that link with you. Which was launched in the lead up to COP26. And essentially, it spells out the global health community's prescriptions for climate action based on a growing body of research that establishes the many and inseparable linkages that we've been talking about so far. The report does highlight 10 priorities for safeguarding the health of people and planet that sustain us. Also worth noting here is that the WHO report on health and climate was launched at the same time as an open letter, which was signed by over 2/3 of the global health workforce, 300 organizations that represent at least 45 million doctors and health professionals worldwide that were calling on national leaders and COP26 country delegations to step up climate action. I think that Shilpa will be happy to know that the WHO report and open letter from health professionals were delivered to COP26 in a very unique way. They went from WHO headquarters in Geneva to COP26 in Glasgow by one of the most sustainable modes of transport, by bicycle. Our own team leader on climate change, Dr. Dermot Campbell-Landrum, cycled the first stretch from Geneva to London, quite the feat, after which a group of pediatricians cycled to Glasgow to deliver the report and letter in person under the banner of A Ride for Their Lives. In any case, the health report shows that achieving the goals of the Paris Agreement has the potential to save millions of lives every year due to improvements in air quality, diet, physical activity, amongst myriad other benefits. However, it is important to note that most climate decision-making processes today don't currently account for these health co-benefits and their economic valuation, and they often exclude non-traditional partners, including essential partners from the health sector. A couple of other things that we've been working on also at COP26. A large number of health professionals had joined the climate strikes that took place on the sidelines of the climate conference and many of the climate events. We at WHO also organized a 3rd Global Conference on Climate Change and Health together with GCHA and other partners on the 6th of November. And the climate conference did bring together health leaders and representatives from various other sectors to call on governments, businesses, institutions, academia, financial sector to drive that green, healthy, and just recovery from COVID-19 that is so urgently needed today. Also, for the first time, the health community had its own pavilion at the UN Climate Conference. So over 60 events were organized in the span of the 2-week period, showcasing the health arguments for ambitious climate action across many different sectors and topics. And the pavilion itself provided a space for the health community to gather at COP26, but also to help mainstream health considerations and action areas that go beyond the health sector, including, obviously, including climate change, but also biodiversity loss through integrated approaches such as One Health. And maybe allow me, if you'll indulge me, to focus on one other activity that we had worked on together with the UK government and other partners. WHO established at COP26 the COP26 Health Program, which is a flagship initiative to bring together stronger health focus and ambition to COP26. So as a part of that program, over 50 countries committed to building climate resilient and low carbon health systems. And they essentially agreed to take concrete steps towards creating health systems that are resilient to growing climate impacts, while many countries also committed to transforming their health systems to make them more sustainable and low carbon. So hopefully more countries will join the COP26 health program in the coming months. We at WHO are also going to be setting up a secretariat to support the implementation of the initiatives that arise from that program. I think I may stop here for this initial intervention, as we may not have time to get into the full range of tools that we've developed over the past quarter century on climate and health to strengthen national capacities and improve the resilience and adaptive capacity of health systems to deal with the significant adverse effects of climate change. But I would like to end by encouraging us all to think about how we can meaningfully raise ambition by working across and beyond our respective institutional silos and with essential sectors outside the environment sector that many stakeholders have traditionally worked with on climate change issues. So that would make the health sector an essential new, but also an essential partner to really bridge the gap between climate, nature, biodiversity loss, and people, so as not to just prevent future pandemics and other negative health outcomes, but also other collapses, including ecosystem collapse and the collapse of our social and economic systems. Thanks so much, Peter.
Okay, thank you, Christina. We'll certainly come back to that question of bridging the sectors in the discussion, I hope. Patrick.
Thanks, Peter, so much for including me in this stimulating discussion. It's always extremely valuable to take part in these conversations, especially when there are so many diverse perspectives. So I'm really getting a lot from this. And Christina's comments made it clear. I just would like to emphasize that WHO has been a global leader in this climate and health space for quite a while, and it was really exciting to see how they really ramped up efforts this past year in the lead up to COP26 in all of the ways that Christina just described. I think it's fantastic. I'm an academic. I'm an environmental health researcher. I was trained as an air pollution epidemiologist a long time ago. About 20 years ago, I started doing climate and health impacts work. And as I've seen this field evolve, I think one of the striking things is how diverse, how complicated, how complex this problem is, how many different research questions there are that really need to be quantified to be able to, inform policy. We need like a much larger public health workforce, people that are trained in climate and health to be able to generate the evidence that's needed for policy. But we also need the research, and I don't think research for research sake is what we want, because of course the climate crisis is extremely urgent and we can't wait too long. But on the other hand, the world needs to take action, and we need to know what actions can not only reduce carbon emissions but can also bring the greatest health benefits. So my own research, starting 20 years ago, really focused mostly on impacts of climate change. I did work on how climate change is going to make air pollution worse and how that could affect health in the future. I did a lot of work on extreme heat impacts on mortality and how that's going to get worse in the future. I was really informed by the motivation of trying to generate some health evidence to bring health into the conversation about climate change. I had seen, with encouragement, how the public health argument for air quality controls had been so effective starting like 50 years ago, and in improving air quality in the US and Canada over that time period. And I was, so hopeful that having health evidence would similarly help drive policy on climate. It's taken a long time. I mean, it still hasn't happened, but I still think that's a really important motivation. Although when I came to BU 5 years ago from Columbia, and I sort of rethought my research enterprise, I really started to think about the need for solutions. I took note of the fact that cities in the United States, at least, were often sort of at the cutting edge of taking leadership on climate action, in spite of the fact that the federal government, continues to lag in those kinds of efforts. But cities need to know what to do and what to do first and over what time span. And so this has really led me into a research direction that focuses much more on sort of low carbon solutions and the health benefits that come from those. And many of the things that we've already heard about fall into this category. And the things I've been focusing on include green space as a adaptation and also mitigation effort in cities, but as well as a sort of a health benefit, and also active transport. Getting people out of private vehicles, reducing emissions, improving air quality, but also increasing physical activity and reducing cardiovascular outcomes. And we did published a paper this past year looking at the northeastern United States Transportation Climate Initiative, which is a policy proposal to reduce transportation carbon emissions by about 25 to 30% over the next decade or so. What we found is that if you invest some of the proceeds of a program like that in active transport infrastructure, you can really generate a lot of health benefits that actually are even larger than the air quality related health benefits, which themselves are quite large. Finally, I'd just like to mention briefly the Lancet Countdown report, which I've been part of in the last couple of years. In that report, it tracks a whole series of global indicators of climate and health from different perspectives, from mitigation, from impacts, from the adaptation perspective. And the one that I helped develop is one on global green space exposure at the urban scale. So working with postdocs and some students who basically volunteered their effort, as pretty much everybody does as part of that Lancet report, we developed a global indicator that reports on the green space exposure across over 1,000 urban areas around the world. And we're tracking that over time, and we'll have an update in the 2022 report as well. So I think I'll just stop there. I want to leave time for discussion, and so thanks so much again for including me in this discussion. Bye-bye.
Yeah, thank you, and thanks to all our panelists for those introductory comments. I did have a series of questions. I was going to ask something about Glasgow itself, but maybe we don't have to. I think we've sort of covered that in a sense that, it was on the agenda, WHO, very active. But maybe we'll slip into something else. I think it's on many people's minds anyway, so I'll ask this question about COVID-19 and the public health crisis. Has that offered any lessons for how we approach the health climate nexus? I was on the IPIS task force that wrote a special report on this with regard to linking pandemics and biodiversity loss. But the climate change issue is, I think, just as important. So would anyone like to make a comment on that, on the COVID-19 and experience that we've all shared and how that can link maybe to dealing with climate change? Christina's hands up. Yep.
It probably comes as no surprise that WHO would want to weigh in on this issue, because I really think that, what's clear is that more than ever, the ongoing COVID-19 pandemic that we are still facing today really brought to the forefront the interconnectedness between people and the natural world, making clear that we as an international community have really largely failed in so many ways to adopt a systems approach to climate change, to biodiversity conservation. And while there's, a narrowing window of opportunity to really get things right, there is a greater amount of scientific evidence and a stronger imperative, I think, than ever to catalyze the political will the international community really needs for transformative change, because we are at that crossroads. We do need that change. And to do so, I personally am a firm believer that more integrated cross-sectoral and interdisciplinary action through a holistic One Health approach. So essentially, just a bit of background, One Health is essentially an integrated cross-sectoral approach that brings together the health of human, animals, plants, and ecosystem health. And I think that this approach will be absolutely essential to better preventing, detecting, and responding to the common challenges that jointly threaten our health, the stability of our planet, the stability of our economies, the stability of our societies, in a more integrated way. As Keith mentioned earlier, the climate crisis, the biodiversity crisis, the health crisis we're all facing, not in future, but right now, are not standalone challenges. They can't be compartmentalized, and are all part of one broader global challenge. And as such, they are a quintessential One Health issue that makes it possible to adopt a more holistic vision and approach to safeguarding, human, animal, and ecosystem health. Why? Why are we saying this? Because the drivers of climate change, because the drivers of biodiversity loss, whether we're looking at deforestation, overfishing, other forms of land and sea use change, habitat conversion and destruction, what you've been working on, Peter, invasive alien species, also the homogenization and intensification of our food and production systems. The confluence of these drivers are not only driving biodiversity loss, but they're also exacerbating climate change. And in so doing, are increasing our exposure and risk to disease emergence, both infectious disease emergence, which affects over 2 billion people annually. And this is pre-COVID-19 figures, 2/3 of which are of zoonotic origin, but also non-communicable diseases, which other speakers have been referring back to, and continue to pose an enormous and growing public health burden that is globally exacerbated by climate change and biodiversity loss. Patrick was referring back to air pollution a moment ago. Over 7 million people annually die every year as a result of air pollution. An estimated 11 million have also been affected by every single year by unhealthy diets. So I think that, going back to your question, there are many lessons arising from the COVID-19 pandemic. And among them, and to complement those that we've already raised, is one, our health is simply not negotiable, and we are fully dependent on a healthy environment and stable climate for healthy and productive lives. Two, the impacts of COVID-19 pandemic on our social, economic, and health systems is only one of many examples in a long series of broader not only sectoral failures, but systemic failures that we need to address, including the failure to make the connection between our own health, healthy ecosystems, our climate, and our social, political, and financial structures. And three, building back better and stronger from the COVID-19 pandemic implies that we have to do things not only better, but differently, with greater urgency, with greater coordination, with greater ambition and coherence than ever before, with a focus on equity as a linchpin, because it's precisely the most vulnerable populations that are least responsible for climate change, that are least responsible for ecosystem degradation, that are most directly affected by their impacts, and those that are least covered by social protection mechanisms. Maybe I'll leave it here for now.
Okay, thank you, Cristina. Shilpa.
Yeah, I'll be brief. I just wanted to make 2 points, but before I get into that, does everyone remember when COVID first hit and There were no planes going around and we weren't driving anywhere. The animals started coming out, nature started healing. I think that was just such a great example of how bad of an environment, of a society we've created. We don't even think about the impact of our day-to-day activities on the planet. And so I just think that's a really good example of how impactful transportation is on our climate scenario. The two examples that I want to highlight with regards to the intersection of climate change and health is the transformation of the streets that we saw during COVID. Paris is a great example where they just like literally were like, no, cyclists are going to be given priority. And you saw this huge increase in cycling because public transportation became quite a bit of a challenge during COVID-19. It's an airborne virus. We don't want to be on a bus with a bunch of people that we don't know if they're vaccinated or they have COVID. So I thought it was really nice to see that these municipalities who for years had said, oh, we don't have the budget for infrastructure or anything to facilitate active transportation, overnight their cities transformed. And I think there's a lot of lessons that we can learn from that. It doesn't take a lot to encourage active transportation in our society. The second big example is, it's not a positive one, it's a negative one. The amount of medical waste we have created during this pandemic is disgusting. We know that this virus is airborne. Why are we cleaning surfaces using hand sanitizer and all of these other things? So I think, again, if we want to take an evidence-based approach, we definitely need research, but this is a great example of where people are not listening to the research. There is no reason that our current public health guidelines should be suggesting that we clean surfaces however many times a day. And so I think that this is one of those examples where we need interdisciplinary committees to come together and look at the evidence to create evidence-informed policies that are taking a lens that's more diverse than just this siloed approach of, okay, healthcare or this type of science. It needs to all come together because the waste that we've created as a result of this pandemic is unnecessary and, in my opinion, unacceptable. I'll leave it there.
Yeah, thank you. Absolutely. I do a lot of work on plastic pollution, and whatever progress we've made, major reversal given the waste associated, unfortunately, necessarily perhaps in some cases, but unfortunately. Keith.
Yeah, thank you, Peter. And just to compliment what Cristina and Shilpa, the important points they just made, is that what we learned from the COVID-19 pandemic, and we at CUGH, we actually ran a webinar right at the beginning of the pandemic because some countries were actually doing a good job. Japan, Taiwan, South Korea. And then the question was, why were they doing a good job and the United States was actually doing a terrible job? It wasn't about money. It was partly about structure, partly about politics. Politics has a major driver, and we do an enormous disservice to the crises before us, including climate change, if we do not, and it's up to us, to be able to think about how we can communicate the solutions that we know work in a different way and in a language that speaks to the incentives that politicians at different levels are driven by. That's what we're not doing. We need to do a better job of that. It's absolutely critically important because if we don't do that, all the wonderful research that's being produced is going to go into a journal and it's never going to be utilized. And that is a colossal waste. Finally, an additional big lesson was the issue of equity. I think Cristina mentioned the issue of climate change affects by far poor countries the largest. Well, we've just seen COVID-19 with the grotesque access to vaccine inequities, that it's low and low middle income countries that have not been able to access the intellectual property that they can make the vaccines themselves, which they can do to protect their own citizens. And then finally, the disinformation challenge before us, which we can address at a later time. But those are three big issues that we need to overcome if we're going to get a 50% reduction in CO2 levels by 2030, because that's our target. We can't lose sight of that. Thanks, Peter.
Thank you. Yeah, we don't have time for disinformation. That's a separate, we'll need a separate panel for that, unfortunately. Patrick, did you have anything you wanted to add to this? Or
no, I think enough said. I'd be interested to hear your next one.
Okay, well, I think we've only really got time for one more, but maybe you could lead us off on this, which really relates to, yeah, what's sort of how do we get the policymakers, the practitioners, the activists, how do we get them better linked with the health community and what's going on? And part of the answer for me is education, of course, and I'm sure you agree, Patrick. But are there other ways that we can do that? Are we resigned to simply lead by catastrophe? Because it seems like it's only when there's a public emergency that we actually have these discussions. How can we make it more mainstream, if you will?
Yeah, that's a real thorny problem. I think we've been trying for a long time to bring health, to put health in a more important part of the policy discussion, and I think progress is gradually being made, but it's been slow. And I mean, unfortunately, I do think that the increasing evidence of extreme climate events and how they adversely affect livelihoods as well as human health is raising public awareness in a way that we haven't been successful in sort of getting the scientific evidence out there into the general consciousness of the public. But when there's extensive wildfires that affect that displace people and also cause pollution throughout the entire Western United States and important parts of Canada, that kind of experience, and when it becomes more prevalent year to year, I think it starts to make an impact. Also, bigger coastal storms, more intense storms have been happening. So yeah, I do think the extremes are going to be sort of educational moments for the general public. At the same time, I think we haven't really, at least in the United States, we haven't invested very well in building the evidence base and getting the scientific evidence out into the general consciousness. There's been minuscule sort of federal funding for climate and health research to date. NIH is now talking about creating a new program this coming year, which I'm really happy about. But we need to put the money into the generating the data so that there is evidence that policymakers can use to justify taking particular actions. You need quantitative information. Otherwise, it's just sort of guesswork and politics, I think. So yeah, I think those are the two things. I think extreme events certainly play a role, but I think we can also put more effort into generating the evidence that policymakers really need. And once that evidence is available, I think it'll increasingly be brought up and taken into account as both mitigation and adaptation actions are taken at the local level.
Okay, thank you. Would others like to address this question?
I can. I have a couple comments on this one. So I think I agree with Patrick, we need data. And so I think one approach that needs to happen is for funding agencies to say you have to address the intersection between climate change and health. So for example, in Canada right now, you can't get a grant without addressing equity and inclusion, sex and gender-based differences. Why are we giving out grants that don't address climate change if this is the most imminent threat to humanity? So I think that type of requirement will force people to come together and start talking about what we can do to really address this issue. I think it's a challenging issue because we're talking about a global issue that affects different countries in different ways and different segments of society in different ways. But we have to work across disciplinary silos to really address this. So I think that could be a bit of a top-down approach where we only fund projects that are really addressing something that's so critical. But on the other hand, of course, I think activists and advocates need to work together across those disciplinary silos and think about, I'm going to use active transportation as the example, but think about these solutions as addressing multiple priorities. So when I think of our municipality, they want to be age-friendly and barrier-free and sustainable and healthy and all these things. Well, this solution, and they want to be net zero, of course, and this solution, active transportation, addresses all of them. So why not invest in that? I think the other critical piece before municipalities or any level of government actually starts to prioritize these solutions, is at the end of the day, elected officials will do what their voters want. And so going back to your comment, Peter, we have to educate the masses on how critical it is that we demand this from our elected officials. Because I can go and present data to council or provincial, federal government, or anyone who wants to listen to me for 5 minutes, but if it's not going to get them reelected to increase tolls on our highways, to create car taxes and all of those types, to remove parking from downtown, they're gonna be they're not going to be reelected if they say that. So we need to sort of educate the population and demand these things so that our elected officials actually prioritize in the budget these solutions that we have. And I'll leave it there. Thanks.
Okay, thank you. Yeah, well said. Keith and then Christina, and then we'll probably have to close this up. I promise to keep it to an hour.
Thanks, Peter. So just following along what Shilpa and Patrick said, the target audience for our communication has to not only be policymakers, but the public. As Shilpa mentioned, the public can move the policymakers. We also have to understand where the power levers are. The power levers are not the activists, generally speaking, but we have to know who's in finance, who are the finance leaders. Those 4 sectors that I mentioned, who are the leaders within those? You've got to be able to influence them to be able to give them solutions that will turn them to support those solutions. Because we all know on this call that there's a gross cost to inaction. And I don't think we've done a good enough job, quite frankly, to describe the cost of inaction to those who are actually maintaining the status quo. Defense sector, really important. They're very powerful at the cabinet table. And we also moving elected officials. I can tell you from being an elected official for a member of parliament for 18 years, as Shilpa and Christina mentioned, it's data doesn't drive their actions. It's about getting elected. And sad to say, equity doesn't drive their actions either. Otherwise, we would have seen entirely different response to the vaccine issue for COVID, to cite just one of numerous examples. And how we communicate, we also have to tell a story. That story has to not only appeal to people's brain, but more importantly, has to appeal to their heart. The most powerful stories that evoke action are those that have an emotional response to that story. So we have to remember, we have to put ourselves in their shoes. The cold, brutal fact of it is that at different levels, as Shilpa mentioned, people want to get elected. Data will not move them. Getting elected will. But we can use the evidence to communicate the solutions in a way that actually gives them a way to meet their purpose of getting elected or reelected. And that's what we don't do a good job of. And we need to do that because we have the solutions on one hand. We have to do a much better job of doing that. We also need a lot more public scientists that are willing to go and speak to the public and to policymakers and the media. Because unless we're doing that, we're sharing all that information to ourselves, we're communicating among ourselves, but the people who are going to make the decisions are not getting that. And that's what we need to do in my view. Thank you, Peter.
Okay, thank you. And I think public scientists have to include those in the medical sector, absolutely, right? Because they're still viewed as very authoritative voices by the general public. I mean, for the most part, I realize you're 10 miles away from the White House and things change there now and then. But okay, so Christina, you wanted to maybe have the last word?
All right. Yeah, sure. Thank you so much for that. Okay, and so many amazing points have already been raised. I think that education, integrated, more interdisciplinary research and education is absolutely essential to bridging across sectors, to increasing competencies across sectors. Building that One Health competency is absolutely essential. Harnessing nature-based solutions in ways that place a value on biodiversity and health and climate are equally essential. They represent 30% of the solution, but are getting very little attention in the international space. Harnessing co-benefits, as the other speakers have noted, is absolutely key. Making sure not only that we have interdisciplinary evidence, scientific evidence, but making sure that that evidence is translational, so policymakers know what to do with it, is absolutely key as well. Making sure that we're linking across mitigation, climate mitigation, and adaptation. Supporting the development and implementation of the health component of national adaptation plans. Developing tools, or actually not just developing, but making use of the tools, the guidance, the training packages on climate and health and nature-based solutions that WHO and so many other partners have been working on over the past several decades. Supporting integrated surveillance and climate-informed early warning systems. You know, overall, let's just look at this as a big picture thing. Overall, 1 in every 4 premature deaths can be avoided by tackling preventable environmental drivers. Yet, even after the COVID-19 pandemic broke out, we're hard pressed as a society to demonstrate that we're internalizing that reality. And Keith mentioned the cost of inaction and the cost of raising awareness. And to that, maybe I would like to close on understanding the value of and investing in prevention. Prevention is infinitely less costly than response. If the COVID-19 pandemic has taught us anything, that would be one key lesson to draw from it. Yet 97% of our investments still go toward emergency response. So really mobilizing international action for prevention is absolutely essential. So I'll stop it there, as I know we're out of time, but thank you for the opportunity. It was great to be with you all.
Yeah, thank you. And I want to thank all our panelists. Obviously just scratched the surface here, but I think we crammed a lot into an hour, quite impressive. And the recording of this will be available on our website. We'll spread that information. I really like the discussion of cost of inaction. I think that message just has to get across to people. I'd also like to, it'd be nice if we could bring in more Indigenous voices into this discussion as well, and learn more from that. And I could go on, but I won't. But I just want to say thank you so much to everyone for being part of this. And we'll continue with this series, this panel series as well, between the two faculties. As Shilpa said, it's wonderful to get these two faculties together and see what we can learn from each other. So thanks everyone, and best wishes.